Welcome to the patient information session for the Englewood Health Program for Surgical Weight Loss. This presentation focuses on the disease of obesity and available treatments for severe obesity. We will review surgical options, covering the advantages and disadvantages with each type of surgery. We will describe what you can expect from weight loss surgery and the commitments you will need to make to lose weight in the safest possible manner, and more importantly, to keep it off for the rest of your life.
Obesity is a chronic disease that is rapidly spreading throughout the world. Know that you are not alone. Obesity is associated with many health-related problems, including type 2 diabetes, high blood pressure, obstructive sleep apnea, liver disease, high cholesterol, and even certain types of cancer. Many of you have tried everything possible to lose weight through diet, exercise, and even pills. The problem is that once you reach a certain level of obesity, those methods don't work long-term. You eventually gain the weight back. Studies have shown that most severely obese people who diet regain the weight. The only method shown in studies that work long-term is weight loss surgery, also known as bariatric surgery. To see if you are a candidate for weight loss surgery, the first thing we check is your body mass index, known as BMI. BMI measures the level of obesity by comparing weight to height. You are a candidate for surgery if you have a BMI of 40 or more. You may also be a candidate with a lower BMI between 35 and 40 if you suffer from an obesity-related health condition.
How does weight loss surgery work? Weight loss surgery does two things. The surgery reduces the size of your stomach so you eat less and feel full more quickly. Also, the surgery affects the chemicals or hormones produced in the stomach and intestines. The hormone changes can reduce your appetite, increase your feeling of fullness, and affect your body's control of insulin and blood sugar. Based on current studies, it is estimated you will lose between 50 to 75% of your extra weight. The weight loss isn't instant. It takes 1 to 2 years. Of course, everyone is different. It is important to remember that weight loss depends not only on your operation, but on what you eat and how much exercise you get. The effects of this surgery are long-lasting, and although there is typically a slight regain of weight, many patients maintain at least 50% of their extra weight loss for 10 to 15 years after surgery. Now, let's look at a few of the surgeries in detail.
Gastric bypass, also called Roux-en-Y gastric bypass, was for many years the most popular weight loss surgery in the United States. Gastric bypass involves dividing the stomach into two parts. The top part, called the stomach pouch, the part that is used to hold food, is only about the size of a golf ball. This small stomach gives you the feeling of restriction so that you can feel full after eating only a small amount of food. In addition, the small intestines are cut and reattached in a Y shape. One arm of the Y is connected to the stomach pouch so that the food bypasses the lower part of the stomach and part of the small intestine. The other arm of the Y carries the digestive juices from the stomach, liver, and pancreas and connects lower down on the intestines. Gastric bypass is especially beneficial for patients with diabetes and acid reflux disease. Studies show that gastric bypass causes remission of diabetes in about 70% of patients, and remission can happen even before the weight is lost. The Roux-en-Y gastric bypass usually takes about 2 to 3 hours to perform. Most patients are in the hospital for 1 to 2 nights, and most return to normal activities in 2 to 3 weeks.
The laparoscopic sleeve gastrectomy, sometimes called the vertical sleeve gastrectomy or just the sleeve, is currently the most popular weight loss surgery in the U.S. Unlike the bypass, the sleeve only involves surgery of the stomach, not the intestine. In this operation, the left side of the stomach is removed. This leaves you with a banana-sized stomach, roughly 1/3 the size of the original stomach. Weight loss is excellent, though slightly less than with gastric bypass. The sleeve gastrectomy is a permanent operation. Once the left side of the stomach is taken out, it can never be put back in. The operation takes approximately 1 to 2 hours, and most patients are in the hospital 1 or 2 nights. The adjustable gastric band, often called the lap band, was first approved for use in the United States in 2001 and has been used for a longer time in Europe and Australia. Although it was quite popular in the early 2000s, it has been falling in popularity because it results in less weight loss than with the other operations and a higher need for repeat surgery.
After surgery. After surgery, you will be on a liquid diet for the first week, and then you'll eat pureed or soft food for about 3 weeks. It is necessary to take the recommended vitamins and minerals after surgery to make sure you don't get any deficiencies. We will see you 1 or more times during the first month after surgery, then 3 more times during the first year. After the first year, the visits are spread out to every 6 to 12 months. Remember, weight loss surgery is a tool and not a magic cure-all for obesity. We know that weight loss surgery works best when you make a commitment to long-term lifestyle changes. These changes include new, healthier eating habits and a regular exercise regimen that help maximize weight loss and are key to helping you keep the weight off for the rest of your life.
Choosing the right weight loss surgery for you depends on many factors, including your age, your medical and surgical history, BMI, and your nutritional and psychological profile. Your lifestyle and your wishes regarding the type of procedure may also influence the choice. Our role before surgery is to provide you with the information you need on each of the procedures based on the latest science. To be sure you have a realistic expectation of what the operation entails and what will occur after surgery, you are the most important part of the formula for weight loss success, and you need to be comfortable with the chosen procedure.
Call us to schedule your first appointment. In the meantime, you can get started by calling your insurance company to make sure that it covers bariatric surgery. We will be by your side through the entire process, starting now.
We would like to thank you for spending some time with us, learning about weight loss surgery. It is our mission to ensure that you progress through your weight loss journey in the safest possible manner. Your participation in the process and commitment to the lifestyle changes necessary for significant weight loss are the key to success. Thank you for listening and for choosing us at Englewood Health. We look forward to assisting you on your journey to a healthier life.